Okay, we are recording. Okay. I'm Carol Olafson, and this is Margaret. How do you pronounce your last name?
Oloyede.
Olafson. Okay.
Yeah.
And this is week 1 of psychotherapy, and I will be the therapist, and Margaret will be the client.
Okay.
So I would, have you come into my office, and so I guess we'll officially begin. I'm Carol Olafson. I'm a therapist, and I will be seeing you today. Just a few things I wanted to start with before we actually start the session. One thing is informed consent, which means you consent to have therapy.
Okay.
And if you want at any time, you can stop therapy, but I just wanted to let you know that. And the other thing I wanted to talk about briefly is just confidentiality. It's between me and you is kept private. There are a few exceptions to that rule. One would be if you're talking about hurting yourself, committing suicide, if you're talking about hurting someone else, I would have to intervene. Sometimes it might be a legal issue. Maybe the court wants information. Basically, the exceptions to that. So we can begin.
Okay.
Okay. Just tell me a little bit about yourself.
Well, my name is Margaret. I prefer Margaret, being called Margaret. So so am I supposed to?
You're supposed to be Eleanor. Do you have the description?
Oh.
She's 72, married, female, and...
Oh, I didn't copy. Okay, okay, now I do understand it. I think I'm not ready. I printed it out, but I didn't know where I put it.
Do you want me to read it to you? Or?
Okay.
Okay. So
yeah, next time I will get ready. Don't worry. This is the first time. I will be next time. Okay.
Okay. So you're Eleanor. You're 72 years old. You're married, and your chief complaint is anxiety and fatigue. And this started about a year ago. And you've gone to the hospital, it says here 7 times, but they couldn't really find anything. They cleared you medically. And then about a year ago, you discovered that your grandson's using heroin. You're thinking about this all the time. You're worried about your grandson because there's an opioid crisis. However, you've been taking lorazepam for 30 years. It's 0.5 milligrams per day PRN for the past 30 years. You do go to a senior center, and you try to talk to your husband about it, but he just doesn't really talk about it.
Understand? Yes, he doesn't understand.
Okay, and then it looks like you tried an SSRI but had some hyponatremia. Okay, so we'll start again. I spoke about the confidentiality, informed consent. So I introduced myself. I'm Carol Olafson. I'll be your therapist. Can you tell me what brings you here today, Eleanor?
I'm here because I'm still having the anxiety about my son, my grandson. That's why I'm here today.
And what is causing? Oh, I'm sorry, I didn't hear that.
Yeah, the medications, they're not working.
Okay, you're taking, what medicine are you taking?
I think I'm still taking the lorazepam, but it's not working. I'm still having the anxiety.
Okay. And what worries you about your grandson?
Because of the addiction. So that's making me, it's causing more anxiety, even depressed about it.
Okay. So you've had anxiety and depression. As far as your mood, would you say that there are times when you don't feel happy or you feel sad?
Yeah, sad because of the issues about my grandson, still thinking about him. So about that is making me sad.
Okay. Now, Well, we're going to talk about your grandson, but I just wanted to talk a little bit more with you about what's going on. Now, are there any activities that you enjoy doing? Do you find joy in doing things?
Yeah, like taking a walk, sometimes I go to the group. Sometimes I join the like a group with
Okay.
with the other people like me, just to go and talk. Even though
Okay.
sometimes it's hard to talk because people over there, they don't understand what's going on.
Yeah, it can be frustrating, I'm sure.
Yes.
Now, have you talked to your grandson about the addiction he has to heroin? Have you talked to him at all about that?
Yeah, I did talk to him, but sometimes he's not ready, he's not listening. He believes he's doing the right thing. So
Okay.
that's the major problem.
Well, that can be frustrating.
And sometimes he's hiding it.
Okay. Now, you you've been having a lot of fatigue over the past year or so, in addition to the anxiety.
Yes.
Has that limited any activities that you do, such as going out?
Yeah, sometimes because of fatigue, it's hard sometimes to get up, to move around. It's hard sometimes, especially when I'm sad.
Okay.
Pressure, anxiety joined together is causing more fatigue for me.
Okay. Now, it looks like you were taking some medication a while ago, but I guess it was affecting the sodium in your blood. And maybe we can talk about possibly, not right now, but possibly restarting medication that maybe would not affect your sodium level. In the future, is that something you'd be open to maybe try?
Yes, yes, definitely, definitely.
Okay. I wanted to ask you, you said you have a lot of anxiety and depression. Do you ever think about maybe hurting yourself?
No, no, not at all.
Okay, good. I do need to ask that. I'm glad. Now, what would you like to do, or what would you like to gain through therapy? What are some of your goals?
Uh, how to walk through my anxiety.
Okay. So find better ways to do.
Mhm.
Okay. Have you thought about anything that might help?
Sometimes I try to take a deep breath, try to relax, try to walk around.
Okay.
Walk sometimes, sometimes doesn't.
Okay. So exercising, deep breathing exercises,
Yes.
and I can go over that in more detail later because that can help relieve
Mhm.
anxiety. Exercising is also good. Now, if you ask your husband, will he talk to you about your grandson?
He doesn't like to talk about it.
Okay, so he is the type of person that just don't talk about it, then it'll
No.
be better. Okay. But you've come here today, so you're taking a big step and realizing that you are having anxiety and that you are very concerned about your grandson. Now, now, as far as the fatigue, it looks like you have gone and been evaluated, but they haven't been able to find a medical reason for that. Sometimes when people are very anxious, along with that, can
Mhm.
depression. And do you ever feel like you just don't feel like getting up out of bed in the
Exactly. When you with the depression, anxiety, you just don't want to get out. You just want to lay on bed. I
morning?
think that's the major problem.
Okay, so
The vertigo.
maybe you don't go and see your friends or relatives.
No, not as before.
Okay, so you've noticed there's changes.
Yes.
Okay. Um, Well, for therapy, we're going to try to help you work through the anxiety and the depression
Okay.
and help you to find ways that will deal with your anxiety. And we can do that by meeting once a week. And as you said, in the future, we may need to think about medications. Do you have any other medical history, like hypertension or diabetes?
No, no.
Okay. Now, as far as the lorazepam, it's prescribed 3 times a day as needed. How often would you say you're taking it?
Sometimes twice a day.
Okay. And when you decide
3 times a day.
Okay. When you decide to take the medication, what prompts you to want to take that? Like certain feelings you're having?
Exactly. Like when I'm really sometimes when I'm really panicking about what's going on, what's going to happen. Yeah.
Okay. So when you feel panicked.
Yeah.
And do you think most of the panic is related to your grandson or?
Yes. That's the major problem.
Okay. So it's mostly about your grandson.
Yes, it's mostly about him.
Okay. Now, a year ago, the anxiety and the fatigue started. Now, before that, did you have any issues with maybe anxiety or depression when you were younger?
Not that no, I don't think so. Maybe once a while, but not like now that I'm having it all the time.
Okay, so it was different now, or the
constantly, yeah.
Okay. Do any of your family members have anxiety or depression?
No, not I know.
Okay, all right. Okay, well, we've gotten off to a good start and we'll continue next week.
Okay, thank you.
Oh, thank you. And just, and then I guess we can switch our roles now.
Oh boy.
I don't think that was quite 10 minutes, but.
Yeah, that was good.
So I'll be Eleanor.
Okay, I just didn't because I was thinking just trying to figure this out for tonight. So the next one, we're supposed to be doing this every week.
I think so, yes.
Yeah. So I will get prepared well for the next one.
It's the first one. I know it's.
Yeah, I don't prepare at all. So, okay. So my name is Margaret. I'm going to be your therapist for tonight. Can you please introduce yourself to me?
Oh, I'm sorry?
Can you introduce yourself?
Okay, I'm Eleanor.
Okay.
I'm married, and I have a grandson that I'm really worried about.
Okay. So what are you worried about him? Why are you worried about him?
Well, I found out that he's been using heroin, and I'm just really concerned. I don't, want him to, overdose, and I worry that, with being addicted to drugs, I don't want him to become homeless. So I've been really worrying about that a lot.
So are you concerned about anything else? Is it just your grandson? Is there anything else that is bothering you about apart from your grandson?
Well, it's mostly my grandson. Well, I've been just feeling really tired for a long time, and I've talked to my doctor about it, and I've actually gone to the ER, gosh, at least twice, and they did all these tests and lab work, and they told me there's nothing wrong. They can't find anything wrong, but I don't understand why I just feel so tired all the time.
Are you getting out at all? Are you working out, or are you working out? Do you have any other thing you do during the day?
I do go to the senior center a few times a week, but if I'm really tired, sometimes I just don't feel like doing anything. I just want to stay home, but I do try to make myself go to the like about twice a week, at least, so that I'm just not staying in the house all the time.
Oh, okay. So, also, uh, are you, can I ask about your husband?
My husband,
Do you like engage? Do anything that like do you guys like talk together, discuss anything?
well, I've tried to talk to him about our grandson because I am very concerned, but I don't know, he doesn't really talk to me about it. I guess he just thinks it's something that's going to go away and not be an issue. But it would be nicer if he, would be willing to talk to me about it.
Yes, because sometimes when two people talk about something that is bothering somebody together, it helps a little bit.
Yes, I think it would help if if he would at least listen to me. He doesn't
Exactly.
have to give me any advice, but if he, could just acknowledge that, I'm just really worried.
Okay. So where's your grandson?
Well, he lives in the same state, but he lives about maybe 45 minutes away. He's still living with his mom because with taking heroin, he lost his job. And I'm concerned about that too, because my daughter's divorced, and I know that if he were working, he probably could help her a little bit.
Yes.
By maybe paying a little bit of rent or something. But yeah, he doesn't have a job, and I'm worried about that too.
Okay. So do you think if you can come to my office maybe once or twice in a week, that will help so that we can talk about it?
I do. I think it's good for me to be able to talk about what's going on and how I'm feeling. Yes, I would like to do that.
Okay. And I will really, I'm here for you. So anytime you really want to come and talk to me, I'm ready to listen to you. What about your? I'm reading your chat. You're taking lorazepam.
Yeah,
Not working for you.
it does. They prescribed it like 30 years ago, and kind of just as needed. I've been taking it a little more often since I've been dealing, with worrying about my grandson. I used to just take it maybe once or twice a day if I was feeling really stressed. But I've been taking it twice a day, sometimes 3 times a day, because I'm having a hard time sleeping too, because I'm, worried about him.
Yeah. Another question: do you have anybody with history of depression, anxiety in your family?
Well, my mom, when I think about it, I think she had anxiety. When I think about growing up, she would kind of talk about the same thing all the time.
Oh.
And yeah, I think like if something happened, I don't know, the car broke down, I don't know, it seemed like she would kind of talk about it a lot and get stressed out. So she's never, I guess, really been officially diagnosed, but I think she had anxiety.
Mm-hmm. That is sometimes, yes. Okay. I can't think of anything.
Okay. All right. I guess we're just supposed to, talk about how we felt doing it.
Okay.
How did you feel?
Actually, I didn't, I know definitely I didn't prepare, but at the same time, you did the first part, helped me a little bit to figure out what I'm supposed to do, how it's supposed to go. So I think nowadays I should be able to at least.
Okay.
Being the first time, because this is the first time I'm doing this.
I know. It's I think I know they were saying silence, you can use silence, but I have to learn, that being silent for like 10 seconds is okay. Because sometimes I feel like I have to keep having like something to ask, you.
Oh, okay. So, okay. Just to relax a little bit. Okay.
Yeah. So I think that was the thing for me, just, deciding, basically, I guess for like, what I'm going to ask you. And I
Mm-hmm.
guess when people are new, you're kind of always thinking that in the back of your mind. And then I guess as you get more comfortable, it just kind of naturally comes to you.
So, yes.
Yeah. Well, I will, I guess I can, stop the recording
Okay.
and then, okay, stop.